am Ann Brazeau, the CEO of MPN Advocacy and Education International. I was with the MPN Research Foundation for many years, and in 2013 went off on my own with their blessings and wanted to focus on education and advocacy, and part of which is this program was born out of that because we recognize the need for issues to be addressed with women specifically, and so that's why we're here. Now, I am so technologically have a problem, but let's see. Okay, challenge, thank you. And forget words. Dr. Ruben Mesa, many of you may know, he is our scientific advisor. He's been with us since the beginning of the organization. He was at the Mayo Clinic. He is now in San Antonio, and we are happy to announce that we'll be hosting an event in San Antonio in 2018. Ruben has been, or Dr. Mesa has just been a real pal. So our goals with MPN Advocacy and Education are to provide as many resources as possible, anything that's out there that can help you through the challenges with your MPN, we want to provide. And also for physicians and researchers and industry. We are very transparent about our relationships with all the people affected or in working with MPNs. And we think it's necessary for your voices to be heard within the community so people know what you're experiencing and might very possibly be able to help. We provide a lot of advocacy support. We select our issues very carefully. We are currently working with Vietnam veterans who were exposed to Agent Orange, who have an MPN and are not getting full benefits, but also we're funding a very small funding project at Memorial Sloan Kettering to look at case studies and to determine eventually, is Agent Orange still within their blood? Is there a specific genetic marker that MPN patients who were in Vietnam have? So there's a lot of things coming out of that initiative. We're also working with pediatric MPN program and young adults with Dr. Nicole Cuisine, who has at Weill Cornell, who has just been focusing on MPNs and pediatrics. So we hope that all of you, but we know it doesn't happen in reality, that you're receiving quality care, and this is a long journey with an MPN. So you want to make sure that you are with a physician or medical team and group that is very supportive and helpful to you, and that you feel comfortable talking to your physician and talking to whomever it is you meet with regularly. I will vouch for the people speaking today. They are lovely, humanitarian, will help you in any way they can. And I would venture to say I know most of them for many years, and I know that if, as a patient, you email or even text sometimes, they will respond to you immediately. So you want that kind of relationship as you go through this journey with your MPN. We try to provide recent updates on research, and that is research everywhere, but again, the MPN Research Foundation has done phenomenal work, off-the-chart work that hasn't been done anywhere else, and Michelle Worley, their ED, will talk to you about that later. We try to keep you up to date on current clinical trials, and I can tell you in 2005 there weren't many, and now there are lots of them. And so if you come to our website and we're missing something and you know we are, please let us know, because we try to stay on top of that. Again, we just try to provide up-to-date, pertinent information for you and advocacy efforts as we see a need for them. So we already discussed this, and the Women in MPN initiative was born out of the many, many phone calls and meetings I had with patients that, you know, it was pretty obvious the biology between men and women is different, obviously, but also, you know, women have children, women go through menopause, women have these symptoms sometimes that are very similar to MPN patient or MPN symptoms. But we really recognize the need to be very specific and hone in on the very specific issues women face. And thus, this is our third annual event. Last year in New York City, we had 150 women there. I mean, it's obviously necessary. We sent out a plea or asked for women to send questions to us that they were afraid to ask their current physician, or they didn't feel comfortable discussing, and we were bombarded with questions that will be answered in part today with our panel discussion. We partnered with Dr. Laura Michaels. I met Laura in Chicago. She's sitting over there. She's going to present to you today. And Laura delved into some of the research that had already been done in a small way and in some larger, many other cases, but and looked at really defining some of the gender differences, and she's been our partner ever since, and you'll be hearing from her today. So we discussed that and that. I'm trying to breeze through this. We want to stay on a timely basis here. And I'll quickly go over some of these issues. Just today, talking to many of you, there are many new patients in this room. And I will tell you, I don't care about the numbers of people at my events. I care about who shows up here, who needs us. And we will do the best we can to help you and to settle your fears, because there are good people in this room that can absolutely wrap their arms around you and get things taken care of for you. So there's a whirlwind that happens sometimes with the diagnosis, as many of you know. And this is so ironic. I tell this story now frequently because I just think it's so bizarre. But I left Chicago, moved back to Michigan, and my neighbor saw me outside and said, "Oh, I'm so-and-so, and I'd love to have coffee with you." And she came over to visit, and she asked me what I did, and I told her, and she said, "Well, do you work with polycythemia vera patients?" And I said, "Yes." And she said, "I've had it for 37 years, okay?" And I share that story with you because she's had major ups and major downs, and now she's kind of leveled off. And with the new drugs that are available, Jakafi for one, she's really been able to keep her platelets down. She's doing well. She's doing well. And I begged her to come with me sometimes, but she's a professor at Michigan State. She won't travel much. And but on the other side of me was a gentleman with CML. And I don't drink the water at my house, but anyway, I've had these great, it was so weird that I moved into this little tiny neighborhood, and I have these people right next to me. So her diagnosis, though, I will tell you, she said it took about 3 years for her to be adequately and correctly diagnosed. And now we're going back some years. Things are a little different today, but I hear over and over again the whirlwind people go through with their diagnosis, with their original diagnosis. There are many treatment challenges. Each one of you is so different. You hear the word constantly in the MPN world, heterogeneity, and that is because each patient is so uniquely different. Someone does well with an aspirin, whereas someone else has to have phlebotomies often and takes many other, meds, and it just depends. And there is no one thing that works for everybody. I always say the patient journey is the road less traveled, because each of you has your own story. Each of you have had to muddle through the process, and the process can be daunting. You hear the word cancer and you say, "Oh my God, cancer." And it's a daunting process, and it's enormously daunting when you don't have the support you need from home, from work, from your medical team. And I know patients that are afraid to tell their workplace. I get it. No promotions, suddenly you're not being listened to because we might have to pay more for this person. This person might miss more work. We all know fatigue is a huge issue with MPN patients, and how is that going to work with your daily life? And so we try to provide as much support to those folks as we can. When I first got into this area or space, the average age we kept hearing was, older people, 62 to 75 or 62 to 80. We can tell you here and now that it just ain't the case. It isn't real. I mean, we talk to people every single day that are in their 20s, 30s, 40s. I mean, there are many, many young people being diagnosed with an MPN. And some of the people here today will speak to, they know it. They see them every day. They see people and recognize that it is not necessarily an older person's issue. So we've also heard, it's an orphan disease. And I go round and round, not round and round in a bad way, but Dr. Messa and I talk about this often, and that is, we're not sure. I mean, the World Health Organization and the CDC collecting this data on new patients is not necessarily been going on the correct way for very long. And so, we believe the numbers are getting higher. The World Health Organization designates a rare disease as 200,000 or less in the United States. And I'm not sure that that is still the case. Men and women experience the same things, well, in some cases, but not always, obviously. And surgeries, no need to bring in specialists or bring your hematologist. I totally disagree, and we have proof that you have to bring your hematologist in to discuss any surgeries. You need your medical team to talk to each other. We have people that have been at great institutions in this country having surgeries and did not get their meds afterwards for their MPN and had major issues, either bleeding or clotting. And so, if you are selecting or electing to have a surgery, you need to bring your whole team together. Let's say you have an emergency surgery. We gave you a card, I hope, when you came in to carry with you in the event of an emergency that has the name of your disease, the name of your hematologist, and that person's phone number in the event of an emergency surgery so they can contact your hematologist and discuss what protocol to use. So there are a lot of things that go on with patients that we don't see. I look in this room and I see people that look lovely and do not look sick. And we had a speaker several years ago who wrote a book called You Don't Look Sick. And so, many of you will go through these periods with certain people that say, well, you look okay, I don't understand. You're walking, you're talking, you have makeup on, you dress nice, I don't understand that you're so tired you can't move, or that you're foggy, or your legs hurt, or, So there's a lot of emotional turmoil when you've been diagnosed, and some people go through, that needs to be addressed. There's huge fear when you hear cancer and a chemo drug, and there's a lot of fear that surrounds this diagnosis, just like any other cancer diagnosis. And we want to help alleviate those fears if we can. You can call us anytime. You can email anytime, and we will do our best to help you through this. There's a lot of uncertainty with the future. I will tell you this, there are some positive things happening that the speakers here today will share with you that were not available, no way, in 2005. I mean, the JAK2 gene mutation was discovered about that time when I got involved with MPNs. And since then, it's just been amazing what the good things that have happened. The financial burden can be tremendous. We also do a lot of work behind the scenes trying to help people get their meds. If you have an issue, please let us know. We have avenues we may possibly be able to help you with. If you're too tired to go to work and you miss a day and you miss out on that paycheck or that larger paycheck, I feel so bad about that, and we want to help, and we'll figure it out. We can't write you a check, but we can try to help you in other ways. The physical limitations, of course, we've talked about, and there's depression. A lot of patients suffer from depression. Sometimes it's temporary, just to get through the initial shock of everything, and sometimes it'll be just a little help through the years. You know, if a person needs it, that is strictly up to the individual and their physician, of course. So we try to encourage people to accept their diagnosis. I mean, what else can you do? You can't really, I mean, you can fight it for a while and be angry, of course, and go through those emotions, but acceptance is huge. And then taking charge, and by being here today, you have indicated to me anyway that you want to know more, that you want to be empowered with the education and knowledge that you need, and staying connected. We have lots of people, we have support groups throughout the country and in other countries, and we have lots of people that are willing to help you one-on-one if necessary, but staying connected sometimes can be very useful and helpful. And staying healthy in other ways. Stop smoking, maybe try a small exercise program, eat properly. There are lots of things you can do to help yourself that do not cost a lot of money, and there are things to avoid and things to bring into your world. And again, the support is very important. I think I mentioned these. This is our social media outreach. If any of you need to use these or do use these, throughout the day we'll be sending information out via Twitter and Facebook. And our newsletter, we have a monthly newsletter, and Marina does a monthly blog. We're kind of going to start doing some other things, but Marina is a pretty good writer, and she shares a lot of good information. She'll be sharing stuff in our newsletter. And that's it. If any of you have any questions for me, I'll be happy. I'll be here all day, and we'll help you with anything you need.